Welcome to the City Current Show. I'm your host, Jeremy Park. We're always honored to bring you inspiring stories of individuals and organizations making a difference and powering the good. And also, too, talking about your health and wellness, especially your back and chiropractic care. We're honored to be joined by our City Current partner, our good friend, Dr. Brittany Kasprack. She is the owner and the founder of Mid South Chiropractic. How are you doing, Dr. Brittany?
Hey, Jeremy, I'm great. Thanks for having me.
Absolutely. You have taken phenomenal care of me personally and my back growing up playing tennis, lots of back problems, and you have put me on the path of wellness for sure. So you and your team do an amazing job. You yourself, though, also have a story in terms of learning the power of chiropractic care. So let's start with a little bit of your story and a horse riding accident.
Yeah, Jeremy. Well, thank you. We're honored to be taking care of you. I actually grew up riding horses, still do ride horses. That's my passion outside of chiropractic. And I actually had a horse injury where a horse reared and flipped over backwards on me. And at the time, my mom was seeing a chiropractor, but she had never thought of chiropractic for kids. And I was maybe 9 years old, 10 years old at this time, and started experiencing headaches following that fall. And my mom finally said, well, to her chiropractor, she said, do you think there's anything you can do? And he said, yes, bring her on in. And he actually is a local as well in Germantown, and got me started in chiropractic as a patient, and I fell in love with it. And pretty much the rest is history. Ended up going on to study chiropractic at Logan University, and it was returned back home to the Mid South and continue to serve the area.
Talk about the multiple locations and you're really being able to help the Mid South with our total wellness.
Yeah, so we've now grown to 4 locations. We're in Olive Branch, Horn Lake, Hernando, and Clarksdale. We've continued to grow and change a bunch of lives. Our goal is to continue that growth and continue to open more locations, allowing us to serve more patients. Our goal here is to really get people to what we call chiropractic wellness. And that is where you're pain-free, you're mobile, you're moving and doing the things you want to do with the support of chiropractic care. So our mission is to get 80% of our community there. And right now the community is at about a 12% rate. And so we've got a lot of work to do. We've got our work cut out for us, but we're going for that 80%.
You mentioned a young age, and when you talk about chiropractic care, it's literally for all ages. And I think, as you get older and you have the aches and pains, especially playing sports, but also too, as you're sitting in your chair at your office all day, there's a lot of little pains that kind of creep in. And so talk about why chiropractic care is so important for all ages and total health.
Absolutely. So people often neglect how much trauma the spine goes through just during childbirth. Basic childbirth is very traumatic to baby spines. And if we can get a hold of those children as they're young and as they're growing and developing and make changes at that time, we always joke that it's a lot easier to keep them well and keep them healthy than it is to fix sick and broken adults. So a huge part of our mission is to get chiropractic to children, babies, infants. Most of our mommies that go through pregnancy care with us, they bring their little ones in right along on the way home from the hospital. So it's a huge component of their healthcare. And again, it's about making sure their nervous system develops properly. If we can tackle that on the early ages in the early stages of development, one, they flourish a little bit better, but also two, we're preventing bigger and more aggressive things. And then of course we treat all the way up into older ages. Sometimes we're doing somewhat palliative care just to kind of keep things at bay so that our elderly patients can maintain as best they can a healthy lifestyle and somewhat supportive care while they are experiencing some of the aging process.
For those who aren't familiar with the process in chiropractic care, walk us through kind of the process, how it starts. Give us some of those details.
Perfect. So chiropractic can be done many different ways. And I always tell people, chiropractic is equally an art as much as it is a science. So it's 50-50. We all learn the same science, but all of us do art a little bit differently. At Mid South Chiropractic, what we do is have the patients come in on their initial visit and we get to know you. So day one is all about us getting to find out what's going on with you and what we can learn from your body. So that first day, we go through a consultation, we go through history. We'll also take x-rays of our patients. We want to make sure that there's nothing underlying, that there's nothing that would be unsafe to adjust, and make sure that we keep our patients safe. Then what we'll do is we'll sit down and we'll develop a plan for those patients. Once we've developed the plan, we sit down with you the next day and we go over what that plan is and what our agenda is, how we're going to help you meet your goals, and if we can and can't meet your goals. We always try to be upfront with patients and realistic. There are some things we can and can't accommodate with chiropractic, but we try to set realistic goals that we can achieve together with our patients. And then from there, we begin what we call your treatment plan, where we start making changes to the spine and getting better function.
I know that you see, especially on social media, sometimes like the cracking and the adjustments,
Yeah.
and there's that piece of it. And so talk about the importance there. But one of the things that I really appreciate is the education side and going through and like on my end, showing me how to stretch properly and making sure that I'm warming up before I play a tennis match. And so the care on the front end of being proactive, I think, is something that's really important as well. So talk about adjustments, talk about education.
Sure. So there are literally 1,000 different types of adjustments. So what you see on social media may or may not be exactly what the chiropractor you see performs. There's a lot of different variations. I think they say there's over 112-ish, textbook written adjustments. And then there's a whole lot of other variations and spin-offs of that, just like there is in sports, right? There's different spin-offs of techniques and different ways to get things done. So with our patients, we work hard to make sure that the technique that we're utilizing with them is what's best for their body. Part of the synergy of us having 7 doctors on staff is that if one technique isn't working, or maybe something isn't effective enough, or there's some other idea that we can apply to that patient, we've got the luxury of having so many different brains and so many different interpretations of what's going on. So that's a little bit of the beauty of what we've got going on here with the different adjustment styles. And then when it comes to chiropractic education, it's a bit the same. There's a whole lot of different theories, a lot of different interpretations out there. We work hard to make sure that our patients understand that chiropractic is all about the nervous system. And what we're trying to do is allow the nervous system to function at 100%. Mobility is key to nervous system function. So if something isn't moving properly in the spine, it inhibits the nervous system's ability to communicate signals. Those signals come from the brain and they feed the rest of the body. And if that signal is off kilter, so to say, we don't have proper communication, we're not going to have proper function. And we work hard to make sure our patients understand that. We go through a series of progress reports, wellness reports, making sure that we're continually following up and touching base with our patients as they progress through their chiropractic wellness journey.
I love that you say it's the science and the art. I think, that's a perfect blend and an explanation. And to your point, the science around communication, your body being able to communicate effectively. And if something's throwing that off kilter, you're going to feel that pain and not be able to function properly. And so I think that's where understanding the importance of chiropractic care in terms of prevention, proactivity, but also to overall health is so important to realize. It is a science. It is there's a huge piece of this that is very important and vital to your body being able to do everything correctly. Carry that forward into educating for companies. You do workshops, you do seminars. I mean, you kind of take the show on the road, so to speak.
Absolutely. So a huge part of our mission, like I said, is to make sure that chiropractic wellness is spread throughout the community. And we know in order to do that, we have to be addressing people where they're at. I'm a big believer in meet people where they are. So oftentimes we'll go into workplaces, whether it be a factory or an admin type facility where there's a lot of sitting, maybe a lot of lifting, bending. And we work with those employees to make sure that they understand what chiropractic is and what chiropractic can do for their bodies. And then, importantly, ergonomics, making sure that they're using their bodies properly when they can, if they're lifting, that they're squatting properly from their knees and not bending from their back, creating further issues. And a lot of this ties into longevity of employees. If you've got a seated job, and I'm seeing some people now sitting 10, 12-hour days, especially those who are working from home and aren't getting up and moving around a little bit, this is taking a toll on the spine, particularly the pelvis and the lumbar spine. That area is not meant to sit all day. And now we've asked our bodies to endure something that, they weren't intended to do. And so we're working diligently to make sure that people understand that we've got to counterbalance that. And it's about longevity. You don't want to be able to do something for a week. You want to be able to do it for years. And I think it's an important part of taking care of your employees, is making sure that, you provide those areas, which is something we really think about enough. We neglect often the day to day. We think about the big, and we forget that day to day, we got to get people up and moving. They can't be in a chair 12 hours straight and to be expected to hold up.
Carry that forward into some tips, because you've shared before in the past things like, taking out your wallet, not making sure you're sitting on it. Like you said, even, getting up every, X amount of minutes or hours and being able to walk and get some exercise. Talk about a few tips.
Yeah, I think one that I really want to hit hard today is electronics. And, we're talking about workplaces. It really is huge in the workplace, but it's also a big part of what we're seeing kids and teens go through right now. We live in this bubble where we're looking down constantly, and that bubble is creating a tremendous amount of effects to the cervical spine. We're seeing headaches, upper back pain, and just complete distress in the upper body, because people are, again, they're maybe looking down at a computer, they're looking down at an iPad, iPhone, maybe doing charts, that type of thing, where they're in a position where they're downward. And again, your body can only handle so much of that. I keep saying that sitting is the new smoking, and it just hasn't picked up yet. Sitting is the new smoking, but the next epidemic is really this, what we call loss of cervical curve, where people are, again, they're sitting, they're looking down constantly. And I want to encourage people to get your computer screens at eye level. You should not be looking down at all. Eye level, which could feel a little funky at first. If that means you've got to lower your chair, then lower your chair a bit. But again, you've got to get, I don't know if they make phone books anymore, but put a phone book under your computer screen, because you've got to wedge them up enough that, your eyes are not having to strain, look down, and whatnot. And then when you pick up the phone, again, bring the phone up. I tell people often, bring it up in front of your face. I don't care how uncool it looks. Your arms might get a little tired, which is probably good because you'll get off of it sooner. But again, it's all about making sure that cervical spine is going to be preserved through this. Parents that have kids that are on these electronics, I know it's it's a challenge right now. Everybody is a little bit addicted to these things. And I find myself guilty of this as well, but it's important. Just bring it up, put yourself in proper position. If you're going to do it without taxing your body. Video games, not wedging the pillow under your neck in order to look up and see them.
All of these I've used myself. I'm now doing a standing workstation to do these interviews. There's little things that I've kind of taken your advice on, being able to be much more mindful of the way that I do my activities related to my back and body. Talk about this for animals, because everything we're talking about also plays into your loved ones, your furry loved ones, and animals.
Yeah. So about 2 years ago, it was always kind of an underlying passion of mine, but something that it had to be the right timing. And about 2 years ago, I got really interested in animal chiropractic. And went through a very lengthy certification process in order to be able to provide chiropractic care for animals of all sizes. So that starts with horses, and it goes all the way down to the little kitty cat running around. It's crucial for them. Now, they are not weight bearing on their spine, so it's a little bit different. They respond a lot faster. They're less likely to need as much frequency, but they're able to show some of the same discrepancies that we actually see in humans. Of course, they're more prone to things that humans are not prone to. You don't often see a dog walking around with a curve in their spine, but nonetheless, they still have some dysfunctions that relate similarly to what humans will see in humans. And so we've really started to build up this passion for treating animals. We've got a large base of animal chiropractic patients. And like I said, they respond a lot faster than humans, because they generally don't get in the car and go eat a bunch of McDonald's and then sit with their legs crossed the rest of the night while playing video games with their neck down. So they're a little bit more rewarding initially, but equally it's super beneficial for them. A big part of our goal is making sure that we keep them moving for the longevity of their life. So we want to keep them well in the sense that they're pain-free moving. Of course, they do have a shorter lifespan, and we want to make sure they're comfortable throughout all of it.
Give me one more thing that you wish everyone knew about the power of chiropractic care.
Okay, great question. One thing I wish everybody knew is that chiropractic really is for everyone. Oftentimes someone will say to me, oh, well, I had surgery, so I can't see a chiropractor. And my rebuttal is always, you had surgery, but it wasn't your entire spine generally. Very rare have I ever seen an entire spine have surgical intervention. But, oftentimes people forget that just because they had surgery, they have 26 other vertebrae maybe that need attention, and maybe even more important because maybe they're prone to certain conditions. So I really think the biggest thing is that chiropractic is for everyone. And like we talked about, infants, children, elderly, it's such an important part of our health and our wellness. And it's a often neglected area that, we don't think to look at the spine as often as we should. And I always tell people, I said, if your spine was on your face, like your teeth, what would people think about you? Do you brush them? Do you take care of it? Do you exercise? Do you stretch properly? Is it in proper alignment? And that's something to think about. What would people think if my spine was on my face?
Well, as I mentioned, Dr. Brittany, you and your team have done tremendous good for me personally, for my health and wellness. And so I appreciate that. Go ahead and wrap up with website, social media, phone number. Where do we go to learn more and connect in with Mid South Chiropractic?
Yeah, check us out, midsouthchiropractic.com. You can find us on Facebook, Mid South Chiropractic. We are on Instagram as well, Mid South Chiropractic. Our phone number is 662-890-0012.
Well, Dr. Brittany, thank you for all you and your amazing team do. Thank you for coming on the show.
Thank you for having me.